What to expect when you come for a macular appointment in the eye department. There are many specialist teams in the eye department, and which team you will see depends on the eye problem you have. The macular team assess patients with problems with the back of the eye. The retina is the light sensitive layer at the back of the eye, and the macula is the central part of the retina, responsible for central vision and fine detail. When you come into the eye department, you will be directed to the appropriate check-in desk, where we'll check you have an appointment, check some details, and ask you to take a seat.
If you'd just like to take a seat over there,
please. You may have your vision checked by a member of the team. It's important to bring your glasses for your vision check, so we know the best possible vision you can achieve.
CKZOH.
It may be necessary to have dilating eye drops instilled, which cause the vision to become temporarily blurred. So it's important you don't drive to your appointment, and take this into consideration when planning the rest of your day. The photography department may use machines to take photographs and scans of the back of your eyes. They will give you instructions as to where you should look so that we can capture the best possible images. A specialist will review your case and any tests performed on the day. This includes looking at the photographs you may have had taken of the back of the eye. They will discuss the best course of action with you, and a joint management decision can be made. They will also decide on the appropriate follow-up time for your next appointment at the eye department. It may be necessary for you to visit other specialists within the eye department. For example, the low vision aid team, who can assess the use of magnifiers to maximise use of vision, or the eye clinic liaison officers, who assist patients with sight loss, closer relatives and carers, to access the practical and emotional support they need, advise on benefits and concessions, and make referrals to provide support with basic mobility and daily living skills.
It's really simple, it just sits in the cup, and when the tea or the drink gets about an inch from the top, it rattles or it beeps.
Sometimes treatment for conditions affecting the macula can involve an injection into the white part of the eye, called an intravitreal injection. We use anaesthetic drops and clean around the eye before carrying out the injection. The whole procedure only takes a few minutes. The team will talk you through the procedure and give advice on the do's and don'ts following an injection. We understand that a new diagnosis can be daunting, and there can be lots of information to take in. We will often provide patient information leaflets so that you can read about your condition at home in your own time. Please feel free to ask any questions you have when you attend the eye department. It's important to remember that your vision may be blurred on your way out of the department due to eye drops or treatment. So for your own safety, we advise you use the lift rather than the stairs or escalators. So, during your macular appointment, you may meet several members of the team, healthcare assistants, staff nurses, specialist nurses, ophthalmic specialists, medical photographers, eye clinic liaison officers, optometrists, doctors, consultants, research nurses, clinical trial associates, and administrative staff, all working together to look after you and your sight in the best possible way.